Good afternoon, everyone. It's Larry Walker, Chair of the All American Rescue Plan Steering Committee. I'd like to welcome the steering committee members. Thank you for being here this afternoon. So I'd like to welcome those guests who are attending either by Zoom or here in this room. I appreciate y'all being here and hope you enjoy the afternoon meeting with us. Also welcome the press. Notice was sent out yesterday, and I think the agenda and background information was provided at that time. So anyway, well, welcome and thank you for being here. The first item on the agenda that I'd like to cover is the approval of the minutes from over there. The Zoom meeting we had on Friday, October the 24th. Those minutes were sent out with the agenda and the other material. Does anyone have any changes or additions that they would like to suggest for those minutes? Hearing none, I would entertain a motion for the acceptance of the minutes for the October 14th meeting.
So move.
Thank you, person. And do I have a second?
Second, AJ.
Thank you, AJ. I have a motion and a second. All those in favor say aye. Aye.
Aye.
Any opposed? Hearing none, so the minutes are approved. The first item on the agenda, well, let me make a couple of comments first. We've been working for the last month and a half based on discussions and committee meetings and discussions we've had with legislature and interested parties having to do with the program with regard to nursing in the state of Arkansas, program with regard to rural hospitals and needs that they have. The nursing obviously is there's a shortage of nurses and other personnel associated with the nursing and the healthcare market, and we're attempting to try to identify what those needs are and move forward with that. So we're bringing forward today some plans that we have developed along with other areas of the state government, Department of Health, DHS, Department of Education. Who else? Anybody else? Have I missed anybody there? So we're bringing that forward today. Rural hospitals. We also have brought to the legislature some requirements or requests from the domestic violence community as well as substance abuse. So we're going to discuss those this afternoon. We have the capital projects money is about $158 million that we want to talk about with regard to allocating that to the broadband projects that are going on in the state of Arkansas. And additionally, there is we're bringing forward the Office of Administration of the Courts and as well as the Sevier County Medical Center. Well, so those are the things that we want to cover today. And I'd like to start with the capital projects fund plan for broadband. And I'd like to recognize Secretary Mike Preston for his presentation on that issue.
Well, thank you, Secretary Walther. I appreciate the committee for getting together to hear these important items. And I'll be pretty brief. I think we've discussed broadband quite a bit from this committee and previously the CARE Steering Committee. So I won't go into the details and the necessity of it as it relates to broadband. A couple of things I just want to point out about this is Larry, you mentioned, this is the Capital Projects Fund. So this money is not coming out of the $1.6 billion that this committee has generally been working with. This was part of the ARPA funds, but this was a direct funding that was done to the state for a specific purpose that's happened to be for broadband. We're bringing it forward now because we finally got our allocation from United States Treasury on what that amount is. And as Treasury has dictated, it is only to be spent on broadband grants and administrative costs. So specifically, we were awarded $158,086,576 for broadband. Of that, $150,236,576 on the grants program and $7.85 million on administration. So that's how those funds are broken down. We're currently in a round of approval for funding for the projects for the broadband. The legislature recently adopted new rules for our broadband program and how those are being evaluated and then eventually presented to the legislature. So we hope to have another round of that to bring to the legislature for the December ALC meetings. But this request here today would approve those funds that have been set aside from Treasury directly for broadband projects as part of the ARPA funds. Again, this is separate from the 1.6 billion that this committee has been dealing with day in and day out. That's a high-level overview. Happy to answer any questions as it relates to this capital projects fund of 158 million.
Okay, so let me make sure I understand. There's a request for $158,086,576, which will be coming out of the capital projects fund, under the American Rescue Plan Act. And that's in your letter to me, dated November the 29th. And part of that will be $150,236,576 will be for broadband projects. There was $850,000 will be assigned for administrative expenses. And that's the allocation distribution based on the federal guidelines. Is that correct?
That's correct. That's what Treasury, the United States Treasury allocated for us and has dictated that this has to be spent on broadband and broke it down between the program costs versus the administrative costs. So that's the request that you have in front of you today.
Thank you. Are there any questions?
Mike, would it be possible to get a update after this is approved as to where we started with broadband, pre-pandemic, and where we are now? Just maybe a color map to show, where how far we've come, I guess is the best way to say it.
Yeah, Senator, thank you for that. I think we have made significant progress. I'd say the best probably thing to look at right now is the report that was done by the Broadband Development Group, because that highlighted where we were and where we've come to and what still needs to be done. That report was done some 6 months ago, so we've made even more progress since then. So those maps continue to be a somewhat dynamic model to look at as they're continuing to be updated, and this will just help us get a step further along. But all those maps are available, on our website by a county by county basis, and we'll bring those to the ALC meeting as we present these on an individual project by project basis. This is just for that lump sum from Treasury. And then we'll use this based on those projects going forward in the next couple of weeks to bring to the legislature.
But we'll update those. We will update those maps.
Those maps will be updated as these projects come online and projects are completed. And there's actually a draft out now from the FCC on the new maps for the country. These are all in draft form. There's actually an ability for communities to go in and comment on areas that there's holes in those maps before they do the final one. And those FCC maps are going to be so important because that's what will determine how much of the infrastructure money the states receive for broadband to be used via the infrastructure money. So, we have our maps. We're putting that input right now into the current FCC drafts, which I believe we have until sometime February-ish to turn that information around back to the FCC so they can better accurately reflect what's going on in each of the states.
Are there any, Senator
I have
Ingram? Senator Ingram, did that answer your question?
Yes, sir.
Okay, all right, thank you. Any other questions?
This is Fran. I have a question.
Yes, ma'am. Senator Kavanaugh, please ask.
All right, thank you. Well, Representative, don't give me that promotion yet. So anyway, but anyway, my question is on the administrative cost. If we can do it cheaper than the percentage that they say, will the administrative cost that can be used in savings, can that be used for more grants?
We would like to. I believe we'd have to actually go back to Treasury and make that request.
Okay, but it is a request we can make. If we can do it cheaper, we can make that request, or are we just stuck?
I mean, we can make the request. I don't know if they'll adhere to it.
Okay.
It would seem to me if there
Thank
were
you.
needs in the broadband areas, the remaining, that would, request would probably be, agreed to.
Yeah, I would think so.
Any additional questions? Hearing none, I'd entertain a motion for the approval of.
I move for
Secretary-
the adoption. I move for the adoption of that process. This is Ken Ferguson.
Thank you, Representative Ferguson. Hey, do I have a second?
Second, Mark White.
Okay, I have a second. Thank you. All those in favor say aye. Any opposed? Thank you. Mr. Preston, your motion has been approved. But I still want you to stay. You don't get to leave.
I know, I gotta stay through the whole meeting. Think I'm on the committee still.
Okay, yeah, you're still on the committee. Okay, the next item on the agenda is the Administrative Office of the Courts. And I'd like to ask Mr. Lothian to cover that proposal.
I've been working with Marty Sullivan about the courts, for the last, 2.5, 3 years. Talking about the need for their system build out for their case management. We talked about this, early on. We didn't think it'd be able to be funded. Clarification came out, from the Treasury Department that in fact this was eligible. And so, the conversation, the discussion with him, we decided that we would try to fund $20 million of the necessary $40 million to do this up front, and then amend the law on the collections of fees from the courts, where currently those fees go into the Administrative Office of the Justice Fund that's administered by DFA, goes out to a list of about 20 entities for their support. That we would change the law to continue to collect the amount of fees that we've collected over the last couple of years, which has been substantially less each year over the last 4 or 5 years. And we would change the law to take additional new collection and split those 50-50 between the Administrative Office of the Justice Fund and the Administrative Office of the Courts. The reason we wanted to do that was that split that goes to the courts would give them the additional funding they need to continue that build out of their system, finalize that, and then give them a method for updating that and maintaining that system going forward. We believe that when they bring that system up on a county by county basis, there will be an increase in those collections back to previous levels. And so at the end of the day, both the fund and AOJ fund and Office of the Courts will both benefit from that. And we'll basically kill 2 birds with 1 stone by getting the collections back where they need to be for the 20 different entities that get funding from AOJ, and give them the money they need to maintain that system and enhance that system going forward. So that's the proposal you have before you today.
Oh, would you reiterate the amount of money that's being requested?
$20 million to fund that, and that will fund about 3-year, about half of the 3-year period it's going to take to finalize the program.
Thank you. Are there any questions?
I have one. Paul,
Okay.
how long before you project that the revenue for implementation of the new system, and how long will that take? And then when will that cash flow start turning around, and do you project increasing?
I'm talking off the top of my head from a long time ago, but the system is partially in place now. And so we expect that even within the next, I think that in the next 6 to 10 months, you'll start to see the increase in the flow of funds. You know, there's some issues there with adoption at the county levels and at the court levels, the various court levels they have. But I think we'll see a fairly good start to that relatively quickly. Now, we haven't sat down and done cash flow projections over that time period. Just because we know what we're seeing in the decreased revenues. You know, they've gone from somewhere in $35 million a year number down to 22 million. And so our thought process was anything we can do to stem that and turn that around would be beneficial to us. We've not sat down and done projections at that level.
Okay, thank you.
Thank you, Paul. Are there any other questions? Hearing none, I'd entertain a motion for the approval.
Stacy Hurst, I'll make a motion to approve.
Thank you, Secretary Hurst.
I'll second.
Who's that?
Mike.
Okay, thank you, Mr. Preston. All those in favor say aye.
Aye.
Any opposed? Okay, thank you. Motion carries. The next item is our, the work, a description or discussion of the work we've been doing on the critical hospitals that, what I call the rural hospitals that, are in Arkansas. And so I'd like for Andy Babbitt to, present that plan for us.
Thank you. Thank you. I would like to first start off and say this is more of an update of where we're at and moving from here. In a previous steering committee meeting, there was an approval for $60 million for rural hospitals. When that request was made to the legislature, there was a lot of concern about understanding the actual need amongst the rural hospitals in Arkansas. Since that time, we have identified a vendor, and you'll see it in your package, Alvarez and Marshall Healthcare. They have conducted viability, both financial and service viability of hospitals in Oklahoma and other states. We're in the process of finalizing that agreement. It will be a special procurement that will go to ALC review. Prior to ALC review and ALC here, we will be asking for a $2 million funding and appropriation from restricted reserve account. And then Alvarez and Marshall will be able to come into the state. We've, with the help of DHS and Secretary White, we've identified 26 hospitals that they will review and report back to us. That will give us the basis for understanding the needs of those hospitals. And if they come to the state, we'll have an estimated dollar amount to fund them, to move them in the process of implementing a plan to make them at least break even, if not profitable. And that is a summary of the critical healthcare plan as we move forward.
Are there any questions?
I have one, Mr. Chairman. What is the timeline for the hiring of the consultant and then the completion of the evaluation? We know we have a lot of hospitals, not only our critical access hospitals, that are hanging on by a thread. So could you give us, Andy, an idea of a timeline on all this?
Sure. ALC, obviously, ALC full committee will meet on December 16th. Once we have the approval, we anticipate completing the contract end of the year, very early part of January. The consultants have told us that they can have a report back to us in 12 weeks on all 26 hospitals. And there's some deliverables in there, but we're looking at about a 12-week lead time.
All right. And one other thing, I know we're talking about something that's already passed, but I want to reiterate that when the chairman talks about assisting rural hospitals, we're talking about assisting some rural hospitals, not all rural hospitals. This plan, as adopted, leaves out hospitals that are within a system. And, you know, our goal is to protect the health of our people in the state of Arkansas, and this limits that. Our hospitals in Helena and Forest City are not eligible for these grants. We've got systems, I think probably that throughout Arkansas that are Arkansas-based systems like Baptist hospitals. I think the hospital in Pocahontas is not eligible for these funds because of the way this was drafted. So I want to say and reiterate again that this is assistance for some rural hospitals in Arkansas, not all. And our people in the Delta deserve to be looked after like others. This is not the way this program has been drafted. You're picking winners and losers, and all these hospitals are important to our people. Is that right, Andy? And I'm right that nothing has changed in what we originally we left out any hospital that had was a system or a for-profit hospital.
Yes, sir, that is correct.
Are there any other questions? Okay, I don't think we need any action on this. This was for to let you know what we're doing. We'll be talking more about this next week at Peter and at ALC. Let's see, what's the next item we're doing? The nursing home, the nursing school plan. Andy?
Okay, the next plan we have, and this will go across for an appropriation request contingent upon plans coming back to be fully vetted by the legislature. We put together, based on input from various stakeholders, universities, the legislative members, and others, a plan here to try to address the shortage in nursing. And this is a short-term addressing of the nursing needs in the state. So we've got 4 areas here we're looking at. Some renovation of educational space, and this is for existing programs in the state of Arkansas to provide equipment such as high-tech simulators for their college campuses. We've got stipends for incoming students. Obviously, as part of ARPA, you need to address the proportionally disadvantaged individuals in the state. And we've got a stipend because what we understand is sometimes just having the proper equipment for the students can be expensive. We've got an incentive here for nursing faculty. What we understand is at some of the 2-year colleges, you can actually make more as a floor nurse or working for the state of Arkansas than you can as a teacher or instructor. So we provide an incentive in this. And then last is clinical space, which will be open to all approved available facilities. So that includes long-term care and hospitals. We also understand there's a need for clinical space for nursing students to learn proper techniques. And the total ask for this is going to be $47.25 million. And that summarizes what's in your package.
Are there any questions?
I have a question.
President Kavanaugh, please.
Thank you. I just want to clarify. So when it comes to the clinical space, the long-term care facilities will be able to get into that rotation to help with these clinical studies of these students. Is that not correct?
It is correct. Yes,
Okay.
that is correct.
Is there any limitation on how many?
No, it'll be, the way we worded this is all available approved facilities. So that would include long-term care in addition to hospitals, and there would be no limitation except for the Board of Nursing sets.
Okay, so how do you become a approved facility?
That is a wonderful question. I would defer to either Human Services or Health for that determination.
Okay, can somebody answer it?
Secretary Mallory's here.
Representative Kavanaugh, I think they have to go through the Board of Nursing to be an approved location to train a nurse. But now I can't swear to that.
Okay. Does the Board of Nursing currently allow the long-term care facilities to be involved in the training?
Representative Kavanaugh, my understanding is yes, they do.
Okay, because I just want to make sure that with the current wording that we have, that we don't create a problem where we need nurses and then we find out after the fact that we can't use facilities that could be actually helping train these. I just want to make sure that we don't create that problem.
Representative Kavanaugh, my understanding is that long-term care facilities can be used. The only part of the nurse curriculum that cannot be learned, from a lack of a better word, is the medical surgical curriculum. It's not.
Yeah, the med surg, yeah.
Yes.
For obvious reasons. So,
yes.
Okay. All right. Thank you.
If I can just add, and Secretary Mallory may have said this, I couldn't quite hear what she said, but it's in addition to the nursing board, there is also that agreement between that facility and the school that is hosting that student. And so the schools work on those agreements. So for example, we have MOUs between our Arkansas Health Center, which is a long-term care facility, and I believe 3 higher education institutions to provide rotation spaces.
Thank you.
Thank you, Secretary White. Are there any additional questions?
I ask a question.
Oh, where did you come from?
My mama. It had something to do with it, but I know. The nuts and bolts of how this is going to framework out, what's the process for determining that? You're going to come before ALC, or what's the process for the nuts and bolts?
What we're going to do is we're going to ask for basically a set aside in ALC, and this program will go over to the Department of Education. There'll be an application process, and then once those are reviewed, then they'll come back to ALC for your ultimate approval and disbursement. Okay.
Thank you. Thank you. Any additional questions? Hearing none, I entertain a motion for the approval of the $47,250,000 allocation of the American Rescue Plan funds for the nursing school program. This this is just to assign it out of the fund. It will also, over time, go before here at ALC for the approval of appropriation to accomplish these this program.
I so move, Mr. Chairman.
We have a motion. Do I have a second?
Second.
I got a motion and a second. All those in favor say aye. Aye.
Aye.
Aye.
Any opposed? Motion carries. Okay. Let's move on to the substance abuse prevention plan, Mr. Just going down the line. Okay, let's do domestic violence. Okay. All right.
Okay, so in your packet, there was a plan for domestic violence prevention. Based on discussions with legislative members and the declining funding for VOTA grants, what we've provided here is in essence a 2-year plan to provide funding to VOTA recipients of $4.2 million, which was generally the difference between the pre-pandemic funding and what we saw in the last fiscal year. which will be 4.2 million a year for 2 years. In addition, this will move the state along in hopes that the VOCA fix that was passed by the U.S. government in 2021 will eventually provide the needed funding to restore grants for the state of Arkansas to previously seen levels. That summarizes. And then in addition, so that's domestic violence. Let me go ahead and kind of bundle these together. In addition, based on discussion with the legislature, this will be the next page. We're asking for a reduction in the amount requested for women and children. We originally come to the committee for a request of approximately $9.5 million. We're asking to reduce that amount from 9.5 to 5.7 million. With the approval of this committee and ALC, that will also clean up some internal housekeeping we do here on our books. That will be to fund the construction of a new facility for Women and Children First. And they have right now support to continue operations into the future for that new facility.
Are there any questions?
Yes, I have a question.
Representative Kavanaugh, please.
Okay, so the domestic violence one, that's going to help us get them back until we can figure out if the fix at the federal level is worked. If it hasn't worked, then we're going to have to come back and address it again in 2 years. That's a quick synopsis of it, I'm assuming.
Yes, ma'am, that is a quick synopsis.
Okay, and then in the Women and Children First, we're wanting to reduce their original request to 5.7 million from the 9.5 that they had originally asked for.
That is correct.
But this still doesn't address the other domestic violence centers in the state. You've got the VOCA funds for them, but this doesn't. I guess I still have personally a little heartburn with one center getting $5.7 million. And then you've got everybody else getting 8.4 throughout the state. It's a little, you know, in my opinion, it's a little heavy handed in one area. Speaking from an area that doesn't really get that much.
Senator Kavanaugh or Representative Kavanaugh, sorry. This, what they're trying to do here is move out of a facility they can no longer maintain because of its age. And they're the only residential facility that of this size in the state currently. They're not, well, it's not even this size, it's less than this, but they're hoping to move this into another area here in Little Rock with a new facility that will have some companion things that can be done with the local law enforcement attorneys, job opportunity, help, and education. And they're building this on a model that's nationwide at this point that's been successful. I don't think there's any place else in Arkansas that currently has the domestic violence shelter that we're currently operating under this entity. And it's going to be, it's going to be a doubling of that almost. But they have been housing people in hotels during the last couple of years because of an influx that they couldn't handle at the local at their facility that they currently have. And I understand we have other facilities, but no one is offering the quantity or the quality of what we're trying to put together here and mimic that national model that's been successful throughout the United States. And granted, it's not a cheap price tag, but with the opportunity to get $4 million from a nonprofit as a match to this grant, we were really asking the state to do roughly 60% of that, with the remainder of that coming from a non-governmental source to support this.
My question really is, do we have agreements between these other, we keep talking about these other partners are going to have them. Do they currently already have those agreements, or is that something that they're going to have to work toward?
They will have to, you're right, they'll have to have some additional agreements, but they're already working with some of these parties currently with the residents they have, but they don't have the facilities set up in the manner that they will be in this new situation where they're on site. They can do this without having to ask the person to travel or go to an appointment in West Little Rock today, North Little Rock tomorrow, or wherever that may be. They'll have facilities there where they can have people come in and talk to the residents there on their property and be able to do that in a much more efficient manner than what they are now to handle that additional load.
Okay, is there anything in the agreement that's going to address that if they don't get those collaborative agreements with these other people that we're betting on, what's gonna happen then?
There's not anything that sorry, go ahead. You go ahead. I think all that is to be worked out, but again, if you're already dealing with some of these entities, and like the local police department and the prosecuting attorneys, if they have, I don't know that they necessarily need an agreement, they simply need the opportunity to serve the public that they're already serving.
Thank you.
Thank you. Any more questions? So, what is the amount we're asking for?
$5.7 million.
It'll be 8.4,
Yes.
and then a reduction of 3.9
Okay.
for women and children, right?
Okay, let's take those together then. Do I have a motion to approve the allocation of $8.4 million for domestic violence, along with a reduction in the amount that we have already allocated women and children first by $8.9 million. 3.9. Apologize. May I have a motion for that?
This is AJ. I'll make a motion.
Thank you, AJ. May I have a second?
I'll second the motion. It's Ken Ferguson.
Thank you. All those in favor say aye.
Aye.
Any opposed?
Haley Barber, Chuck Lott, and Lance Bruce are notable Republicans from Mississippi. You don't know who's playing?
It's so fast. Huh? Harold, was that you talking?
No, sir.
Okay, motion carries. The next item is, okay, the substance abuse.
Yes. All right. So our fourth plan here again is to address some of the concerns that we've heard from the legislature. We've worked with DHS on this proposal. And our estimated cost would be $30 million with an additional $150,000 to help offset the administrative costs that DHS has. This is going to go directly to support substance abuse prevention and services to reduce the detrimental effects of substance abuse in the state of Arkansas. We've got 4 proposals currently, and on the map on the second page of your document, you'll see in where it's colored, those are the coverage areas for the 4 we have. In addition, one of those, which is RVAC, they provided a map today that they'll actually cover additional spaces in mostly in north central Arkansas, running from Boone over to Sharp County, down to Independence, Faulkner, back over to Perry and up to Newton. So I'm kind of making a circle in there. So that will be one of the proposals. You'll see also River Valley Natural State and Harbor House. Those have been proposals we've had for more than 6 months. These are operations that are currently in existence, currently provide services, I believe, under DHS. Secretary White will confirm that for me. And that will, in effect, require approximately 10, looking for a dollar amount here, approximately 10.5 million. That'll leave 19.5 million to, for DHS to work to find entities that can cover the uncovered part of the state. And if anybody's got any questions,
I have
Have
a
you,
question.
have you discussed the specific before
I have not. I can go through the specifics of the school. Okay. In addition, in your documents, you'll see a summary of the substance abuse prevention proposals. We've got RBAC. They operate generally out of Russellville, but they cover a large portion of the state. They're going to expand services, including having childcare slots and 80 additional beds. They have specifically requested $708,000 and change there. Arbor House is a drug recovery program. They're talking about constructing a transition living housing facility in Fort Smith and Hot Springs, renovating some additional space, both in their men's facility in Fort Smith and providing renovations in their specialized women's services. They requested $5 million. We believe an allocation amount of $3.3 million, as you can see. Natural State Recovery Center. They originally requested $9.2 million. We believe an allocation of $4 million. Here again, it's going to be general renovations of existing facilities, providing various upgrades to their current infrastructure. Then we have River Valley Medical Wellness. They originally requested $4.9 million. We recommended an allocation of 2.5. Again, it's renovation of existing facilities, both in Russellville and in the Hot Springs area. And those are the summary of the 4 proposals we have.
Are there any questions?
Mr. Chairman, I have a question.
Senator Ingram.
So we've got 30 million that we're going to allocate for the colored areas, which it appears that that's maybe a third or 40% of the state. But for the rest of the state that is uncovered, we're only going to have 19 million for the bulk of the state.
Hey, yes, and y'all, unfortunately, I didn't have this map. RBAC provided it today, so RBAC will expand their coverage area. They'll add in approximately 11 more counties. So they will cover with what you have in your map and what they provided today. They will cover approximately 40 counties in the state. So we'll have 19 million to cover the other 35, 37 counties.
But Eastern Arkansas and Northeastern Arkansas is completely void of anybody providing this service as of now, correct?
We do not have proposals for that area. However, Secretary White, I believe he can address this a little bit better than I can. They actually have entities that provide services in those areas that may be eligible or probably will be eligible for these grants. All it will take is an application process.
Do we know how many substance abuse beds are in the state? I mean, is there, you know, we know how many hospital beds we've got and sort of what our optimum number is. Do we have those kind of figures for substance abuse?
Senator, we can work to pull some of those numbers together. I will tell you that, of course, we have some substance abuse beds through Medicaid. We also have some that we contract using some federal funds, but there are also beds that are privately paid, privately funded. And so there's that mixture throughout the state. I think we would certainly say there are not enough beds across the state, but as far as some specific numbers, we can get those for you. And if I can circle back and just a couple of points, I think to help illustrate your earlier question. Number one, the regions that are shown here, these are 8 regions. That is based on the regions we use for funding substance abuse treatment using our federal dollars. And so the thought was we have contracted providers in each of those regions. There are other providers we have under contract, provide services both for treatment and prevention. And so we do have providers located throughout the state who potentially could be eligible for these funds and to access these. And I think there may be some confusion on the total amount, and Mr. Babbitt can correct me if I misstate this, but my understanding is that the total amount to be used for these services is 30 million. 10.5 would be for those 4 proposals in the areas outlined on the map, with the remaining 19.5 million for the remainder of the state.
Okay. Mark, is there any figure per 100,000? Is there any national average, say how many beds per 100,000 that you need for effective substance abuse counseling?
There is not a national average, but I know that at least for the state, our need is increasing. Because we saw starting in 2019 and then especially into 2020, around the same time as the COVID pandemic started, we saw a significant increase in drug overdose deaths. And so just for some context, in 2019, we had 352. In 2021, we had 618. So we know that if there is a national standard or average, that number is probably out of date because the need is increasing.
Thank you.
And I have a question also.
Representative Kavanaugh.
Okay, on the individual proposals, I noticed that RVAC seems to be the only one that's actually adding additional beds. Nobody else says they're adding additional beds. There's a lot of renovation to them, but it doesn't show how they're going to increase and help us to deal with the substance abuse problem that we have. The natural state says they're building a greenhouse and doing some repairs, and I'm all for that, but how are we actually getting more people helped in some of these proposals? And River Valley, it talks about renovations and acute patient care, but I don't really see like an increase in beds beyond RVAC. So are they not increasing people that they're going to be helping?
If this is Carl Norris with Harbor House, and perhaps our application doesn't express that, but our renovations allow us to expand our services. We have rooms that are not being used because they're in disrepair. So with these renovations, we will be adding beds both for men, for women, and for women with children in our women services area.
Do you know how many beds?
Well, I know a dozen because we've counted the rooms, and maybe more than that. We have about 120 beds now in both of our locations, and those dozen, 10 to 12, we know will be in the women and the women with children, because we're going to move ladies out of the residential treatment area into transition living, which will free up rooms in the residential treatment area for treatment rather than for transition living.
Okay.
And I don't want to overstate it or overstate it, but at least a dozen.
Okay. And what about the other ones?
This is Dr. Kristen Martin. I represent River Valley Medical Wellness. And as a physician for the last 14 years, I've done ER family practice and now addiction medicine. Our program is not exactly situated like the other treatment centers. We are a multi-purpose community program, which our map is actually incorrect. In the last 2 years, we've seen over 2,100 patients in 58 of the 75 counties that we reach that come to our programs, or we do outreach through going to those communities in order to care for people. We don't necessarily increase beds, we're increasing space and capacity. And our proposal doesn't totally outline it here, but it's increasing the services and also proposing mobile units that are something other than our cars meeting people in crisis, but actual integrative care units where we can provide substance use, mental health, and reach those critical areas that are not being reached by other resources, if that helps explain some of it.
Okay, so in the River Valley, so y'all don't have beds for people? You're doing mostly mobile and outreach?
So we are a clinic that we started out very small, at about 500 square feet a couple years ago, and have grown rapidly because of the great need. So part of ours is renovation and expansion of our services so that we can see people in person. We tried to make shift with telemedicine, but the fact of the matter is people need in-person services as well. And then being able to expand out from there. Our services have primary care, addiction medicine, mental health providers, peer recovery specialists in all of our programs. So it's expanding all of those services because the demand on what people need is greater than our current facilities have been able to provide.
Okay, thank you. Anybody from Natural State?
Mr. Hughes?
Yes, I'm here. This is Cope Hughes with Natural State Recovery. A lot of what we have proposed, we are a residential treatment facility with 54 beds. And the services that we propose to increase are all of the ancillary services that people's commercial insurance and private pay will not cover, and things that we found have been, the most beneficial to sustain the recovery process. While the beds are very important, where we lose track of people is outside of once they leave those beds and returning back to the community, getting a job, continued peer services, alumni program, and then offering job training services, along with being a resource for the community of Oak Grove that we reside in, since we've renovated the old high school over there. So we're not increasing our services and trying to increase the scope of how long we're keeping people in the recovery community, instead of just turning them back out loose into the community and not being able to receive those services past that, because their commercial insurance or all of their needs can't be met with what those services provide.
Okay, and with this, the $4 million that you're going to be doing for the renovations and these other programs, and you have a long-term plan for once this is done, that you'll be able to be sustainable in those services?
Absolutely. I mean, the barrier to that right now is just the renovation cost for the facility that we reside in is just I don't know if you've ever been to the Oak Grove community, but it was an old facility and a lot of disrepair. So the barrier to continuing those services and getting them off the ground is simply just getting it back into a state in which we can move.
Okay, thank you.
Yes, ma'am.
Thank you, Representative Kavanaugh. Those are great questions. Are there any additional questions? If not, I entertain a motion for the approval of $30 million for the substance abuse prevention plan out of the ARPA.
I so move. This is Ken Ferguson.
Okay, sir.
Okay. And then also in addition to the 30 million, 150,000 for administrative expenses for DHS.
And that would be combined, so it'd be a total of $30,150,000. Would you make that motion, Representative Ferguson?
Yes, I'll make that motion.
Thank you. May I have a second?
Second.
This is AJ. I'll second.
We have a second. All those in favor say aye. Aye.
Aye.
Any opposed? Okay, thank you. The last item on the agenda is the Sevier County Medical Center.
Okay, our last proposal of the day is the Superior County Medical Center. Let me first start off by saying that ARPA funds were initially and continue to be provided to the state of Arkansas to address the disproportionate impact in Arkansans in the state. Sevier County had a hospital until about 4 years ago, when the chief executive officer was convicted of Medicaid fraud and is sentenced to federal prison. So the county has stepped up. They have a sales tax, as I understand it, which they have bonded and built a new hospital there. And they're coming to ARPA to provide $6.25 million to help provide beds, all the sorted equipment that is needed for the hospital to begin operations. And this is because, as we all know, during the COVID pandemic, there were supply chain issues, staffing issues that drove up the cost for the construction of the facility. And we have Lori House here to add to this. She's the CEO of the medical center, if y'all have any questions.
Are there any questions? Lori, would you like to make any comment?
Well, just thank you for having me here today. And, you know, our community has been without a hospital for the past 4 years. And we feel that, you know, we can't go any longer without being able to provide that emergency and needed necessary care right here at home. So, you know, any questions that I can answer for you, I would be happy to.
Thank you, Lori. Are there any questions for Lori House? Hearing none, I would entertain a motion for the approval of $6.25 million to the wrong one there for the Sevier County Medical Center.
I'll make that motion. This is
Thank
Mike.
you, Mr. Preston. Oh, do I have a second?
Second.
I have a second. All those in favor say aye.
Aye.
Any opposed? Okay. Is there any other business to come before this committee tonight? Hearing none, we stand adjourned. Thank you.